Hello students, we'll discuss instrument today. Just to find out what this instrument is. Look at that. There is no lock here. That's very, very important. Distal blade, distal part, there are serrations like this. There are serrations. There's only distal part. Without lock, what this instrument is, it's nothing other than Lister's sinus forceps. So the sinus forceps is no lock. It is currently used to drain an abscess cavity by Hilton's method of drainage. It's a common MCQ ask or Viva they will ask. Hilton's method of drainage. Abscess, it's a localized collection of pus in a cavity lined by granulation tissue covered by pyogenic membrane containing pus in locali. Localized word is very, very important. It is drained and by regional anesthesia, not local anesthesia. Local anesthesia will not act because pus is acidic. Lidocaine will not act in acidic media. So you have to make, you have to aspirate and confirm it is pus first thing after cleaning and draping. Then you have to make incision over the dependent portion, adequate length incision. Open the using 11 number blade. Open the pyogenic membrane with the sinus forceps. Break all loculi. Collect the pus for culture. Give a warm saline wash. Don't suture the wound. Put a pack or gauze, drain in a large abscess or a gauze pack into the cavity. Then send the pus for culture. Of course, all these things should be started after giving antibiotic under the umbrella of antibiotic coverage. So that is how we exactly will drain an abscess. So sinus forceps originally designed to pack the sinus cavity. That's why hence the name. Joseph Lister, the British surgeon who started the use of carbolic acid as antiseptic solution for the wound with a very, very successful decreasing the infection rate after surgery. He also started thought that airborne in the OT infection can occur. So sterilizing the air, operating room air will have the more beneficial to control the infection. That's what he thought. A lot of disinfection, he's a father of antiseptic surgery, a great British surgeon who invented or postulated the antisepsis and asepsis in surgical field. So please read my clinical methods in surgery for other instruments, also my manual of surgery for instruments. So other instrument also. Request you to subscribe my YouTube channel, share with your friends and colleagues, and press the bell so that daily images, instruments, X-rays, specimens, clinical cases commonly, interesting cases, and brief operative procedure you can learn. Share with your friends also. Day-to-day basis you can learn. Also join live session once in 2 weeks with the long cases for 1.5 hour interactive discussion in detail, so that will be useful for your practical exam. And whoever join will get a certificate of joining, which will be very useful for your future career. Again, request to join my YouTube channel. And students, answer the MCQ, what this instrument is, A, B, C, D, find out the right answer, and I'll appreciate your answer. Another MCQ, what this condition is, A, B, C, D, find out the right answer. I will appreciate your answer, put it in the comment box. And the quotation of the day is, when a storm attacks, all big trees get uprooted, but simple grass always survives. Simplicity and without ego makes us more stable and stronger. It's very, very useful. Do not have ego in surgical field. Be simple. It will be appreciated, especially in surgery. That is very important. So students, again, I request you to purchase my manual of surgery and clinical method surgery. Also join my website, SRB Surgical Insight, and subscribe it and share with your friends and colleagues for day-to-day update in surgical, different surgical aspects. Students, I hope you have understood this lecture very well. Thank you so much.